Now for testing the movement of cervical spine, let's first start with the flexion and extension. So for that, you ask the patient to hold a scale like this and then to bend the neck fully, bend the neck as much as possible. So normally the patient is able to touch the chin to the chest. And when you are testing this, the flexion is around 80 degrees in cervical spine. This is the normal range of movement. So you put the scale in the patient's neck, patient's mouth, and then you bend it. So either the sternum should touch the jaw, or if the patient is not able to do it, then supposing if there is a lag like this much, then what you have to do is you take this, you measure this angle with that of the horizontal. When you measure this angle with the horizontal, then that is the amount of flexion that you are getting. Similarly, for extension, you ask the patient to look as up as possible. So normally this is the extension that can be achieved. This is around 50 degrees. So 50 degrees of extension and 80 degrees of flexion is the normal cervical spine range of movement when it comes to flexion and extension. Here also, to the horizontal, you measure this angle. This gives you the amount of extension that the patient can do. Okay, normally better. Flexion is normally done by sternocleidomastoid muscle, and the nerve involved is spinal accessory nerve and C2, C3. Extension is normally done by trapezius and muscle and nerve from spinal rami C3 and C4. Next is to check the lateral bending movement of the cervical spine. For that, again, you ask the patient to take the scale and put it in his mouth like this. Then you ask the patient to tilt the neck as laterally as possible. Normally, when the patient is able to do this, you measure this angle with the horizontal. This angle is around 45 degrees. Similarly, you ask the patient to do it on the opposite side. Here also you measure this angle. Ideally, the angles on both the sides should be the same. Next, we come to the side bending movement of the cervical spine. So for this, you ask the patient to bend his neck to the sides as much as possible. Normally, the patient is able to bend till 80 degrees. If you want to assess this in a better way, you look from here, from the top, because while doing this test, you can ask the patient to sit on a stool which is low lying. So the patient rotates his neck like this and then to the opposite side. Using this scale gives you a benefit when you are viewing from the top and you want to measure the angle with respect to the vertical.